Hi everyone, my name is Leila and I'm here today with Chase. We corresponded with Nicole to create this diabetes management presentation. So first off, what is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy. The body either doesn't make enough insulin or is unable to use the insulin as well as it should. So normally glucose in your blood comes from the food you eat. Insulin then takes glucose out of the blood by turning it into the energy. Some risk factors for type 1 diabetes include family history or age. Normally, it develops in children, teens, or young adults, but it can happen to anyone. Type 2 diabetes risk factors includes prediabetes, being overweight, age greater than or equal to 45 years old, a family member with type 2 diabetes, being physically inactive 3 or more times a week, gestational diabetes, or your ethnicity. So what is the difference? For type 1 diabetes, the pancreas makes little to no insulin, whereas for type 2 diabetes, cells don't respond normally to the insulin, which is insulin resistance. Some symptoms and complications of diabetes include hyperglycemia, which is high blood sugar, and the main symptoms to look out for is excessive thirst, hunger, and urination. On the other hand, there's hypoglycemia, which is low blood sugar, and this is important to look out for when taking diabetes medications. And for this one, the main symptoms to look out for include shakiness, tremors, sweating, dizziness, or weakness. And for complications of diabetes, it's distinguished into acute and chronic categories. Hyperglycemia can lead to diabetic ketoacidosis or hyperosmolar hyperglycemic state. And for hypoglycemia, it could lead to a coma and even death. Some macrovascular complications include coronary artery disease, cerebral vascular disease, and peripheral artery disease. For microvascular, it could lead to retinopathy, nephropathy, or neuropathy. And some blood glucose goals we wanted to note are here: an A1C of less than 7%, preprandial glucose, which is 80 to 130, postprandial glucose less than 180, and a random glucose of less than 200. So when experiencing a hypoglycemic attack, it's important to follow the 15-15 rule. And this would be whenever your blood sugar is less than 70. And it's important to note this is even if you do not feel any symptoms. For step 1, if you do feel any symptoms, check your blood sugar for a less than 70 value. If so, you want to eat 15 grams of carbs, and this includes examples like half a cup of orange juice or 3 to 4 glucose tablets. You're going to then want to wait for 15 minutes and recheck your blood sugar for a value greater than 70. If so, you want to eat a nutritious meal or snack like a small sandwich. However, if it is still less than 70, you want to repeat the 15-15 rule one more time. At the end of this second 15-15 rule repeat, you want to check your blood sugar, and if it is less than 70 again, you need to seek medical attention. So how to use a glucometer. First, you want to prepare your supplies and make sure to clean your hands. You want to turn on the glucometer by inserting the test strip and then prick your finger, squeezing a drop of blood out. And then place the drop onto the edge of the test strip and wipe away any remaining blood. Then the glucometer will display your results.
So now I'll be talking about some lifestyle recommendations for people with diabetes. Generally, you want to get at least 150 minutes of moderate intensity aerobic activity a week, spread out over 3 days of the week, as well as do resistance and or flexibility training 2 to 3 times out of the week. Should not go more than 2 consecutive days without exercise and should break up prolonged sedentary activity every 30 minutes. When measuring the intensity of exercise, you should remember the sing talk test. So if you can talk but not sing while you're doing an exercise, it's considered moderate intensity. But if you can do neither when doing an exercise, it's considered vigorous. So examples of moderate intensity exercise include brisk walking or general guarding, while vigorous intensity exercise can be jogging, running, or jumping rope. So on to diet choices. In general, people with diabetes should be eating more whole grain foods, fresh fruits and veggies, healthy nuts, lean protein, and healthy oils such as coconut, avocado, or olive oil. And should be eating less of processed food. And this can be considered like canned foods or fast food. Should also be eating less refined grains such as white rice or white bread, and should be limiting the amount of sugary drinks and sugary snacks you're consuming. So this brings me to something called the diabetic plate method, which is just a way for someone to manage the amount of calories that they're intaking as well as the food that they're eating. So on a 9-inch plate, 50% of the plate should consist of vegetables, and generally the more colorful, the better. 1/4 should be whole grains and starches, and the other 1/4 should be lean protein, such as turkey, chicken, or fish. A small amount of fruit can be eaten 3 to 4 times a day, and this should be eaten in moderation as fruit does contain a lot of sugars. And as I stated before, you want to just limit the amount of sugar that you're intaking throughout the day. So weight loss is also an important component of the lifestyle recommendations, and CEC recommends losing between 5 to 10% of someone's or a person's total body weight. This makes it easier for one to manage their blood sugar levels and may also mean that that person would require less diabetes medications. It also leads to an overall improvement in quality of life, and diet and exercise are key to losing weight. Now onto the pharmacological treatment for diabetes. So as all of these medications lower blood sugar, it's important to keep in mind the signs and symptoms of hypoglycemia and know what to do if in the instance that a hypoglycemic incidence occurs. So the first medication is arbiguanide, and the only medication in this class is metformin, and it works by lowering liver glucose production, intestinal glucose absorption, and improving insulin sensitivity. Mainly causes nausea, vomiting, diarrhea, and or flatulence, but this can be reduced by taking it with a meal. Next are the sulfonylureas. This includes glipizide, glimepiride, or glyburide. It increases insulin released, increases sensitivity to the insulin, and decreases glucose released by liver. It has a higher risk of causing hypoglycemia, and it may also cause some weight gain. Next are the GLP-1 agonists. Common ones are Ozempic, Trulicity, and Victoza. They increase insulin secreted and decreases glucagon secreted. So glucagon is a hormone that can be thought of as the opposite of insulin, and instead of decreasing the amount of sugar in your blood, it actually increases it. Main side effects for these meds are nausea, vomiting, and diarrhea, but this is limited as a starting dose will be very low to help your body adjust for when you go up to higher doses. Next are the DPP-4 inhibitors. Common ones are Januvia and Tradjenta. It has the same mechanism of action as the GLP-1 agonists. They're generally very well tolerated, but pancreatitis is a rare side effect for these. Then there's the SGLT2 inhibitors. These are Jardiance, Farxiga, Steglatro, and Invokana. They increase the amount of glucose urinated out. So main side effects are potentially urinary tract infections and dehydration, but drinking plenty of water with these medications can limit this. Next are the thiazolidinones. These are pioglitazone and rosiglitazone. They increase body sensitivity to insulin, but may cause weight gain or edema. And next are the insulins. So most common ones are long-acting and short-acting. Long-acting agents include Lantus, Plasmaglar, and Toujeo, Levemir, Tresiba, and short-acting include Novolog, Admelog, or Humalog. Insulins put insulin directly into your body to help reduce blood sugar. And the main adverse effect with these ones is hypoglycemia, and insulins have the highest risk out of all diabetic medications for low blood sugar. So it's important to always be checking your blood sugars when on insulin, and it may also cause weight gain. So just a quick overview of how to use insulin pens. First, you're going to need to remove the pen cap and then wipe the top of the pen with an alcohol swab before attaching the needle. And then you're going to need to prime your pen. The units that you need to prime your pen may differ from insulin to insulin, so just make sure to pay attention to the directions. Then you're going to need to set your dose and then inject yourself. And then it's always important that you hold your pen you hold your pen in place in your body for about 10 seconds to make sure all the medication is released into your body. And then after that, you can dispose of the pen needle into an appropriate sharps container. So follow up with the physician is generally every 6 months if your sugars are within goals, or every 3 months if your sugars are not within goals, or if the medications are being adjusted. Doctor is going to be looking for effectiveness and appropriateness of the medication and a need for a dose increase or decrease, as well as side effects, and give management tips or medication changes as needed. Monitoring blood glucose for insulin. So if you're on a long-acting insulin, you want to pay attention to the fasting blood glucose, which is going to be at least 8 hours without food. And the target goal again is 80 to 130. And if you're on a short-acting insulin, you want to pay attention to your postprandial blood glucose, which is going to be 1 to 2 hours after starting a meal. And this target goal is less than 180. So in summary, diabetes is a condition manageable with lifestyle changes and medication. It's important to prioritize your health and take your meds as prescribed by your doctor and follow up regularly to ensure that your diabetes is well controlled. And if there are any questions or concerns, make sure to reach out to your doctor or pharmacist for help. Here are some additional resources from the CDC, Mayo Clinic, and NIH on more diabetes management tips. And here are references. And thank you so much for listening.